All right, welcome everyone. Thank you for joining us. Good morning, good afternoon, and good evening to wherever you are in our wide world, and welcome to this NetHope webinar. My name is Seth Otto, and I'm the Digital Communications Manager here at NetHope and producer of the NetHope webinar series. Before we begin, and on behalf of all of us here, we would like to say that our hearts and minds are filled with thoughts and prayers for the people of Morocco and Libya today, and Godspeed to the emergency relief efforts happening there on the ground. We are delighted to be joined today by representatives from Trek Medics, Tanzania Rural Health Movement, Motomeds Haiti, and Impact International. And they're going to share with us some of the stories and ways in which Trek Medics works with local humanitarian groups to deploy and manage community-based emergency response systems using basic mobile technologies. Let's go over a bit of housekeeping before we get started. First off, let's make this webinar interactive. Let us know what comes up for you. Please post your comments and questions in the chat window. The presenters will address them during the question and answer period. Please pay attention to your inbox for a follow-up email that we will send your way after today's webinar. The email will include links to the webinar recording, the slides, and any other resources shared during today's presentation and discussion. And we value your feedback. Your opinion matters to us, and we use your responses to our survey to improve this webinar series for you and our broader NetHope community. It also provides our presenters with an opportunity to connect with you if you want them to. And with all of that out of our way, I would like to welcome today's speakers. Jason Friesen is the founder and executive director of Trek Medics International. Dr. Marco Hingi is the founder and CEO of Tanzania Rural Health Movement. Molly Klarman is a program director at Motomeds Haiti. And Katrina Roller is Sorry, Katrina is a dispatch coordinator at Impact International. Jason, I'll now hand things over to you to get us started.
Thank you very much. Real pleasure to be here and very grateful to NetHope for the opportunity. Actually, Seth, if you could allow me to share my screen. Perfect. So I'm going to pull this up for everyone. So as Seth mentioned, my name is Jason Friesen. I am a paramedic by training and the founder and executive director of Trek Medics International. And I'm really here to share with you today why I've got such a great job. And as founder and director of Trek Medics International, I get to work with two groups of people. And I understand these slides are being saved or shared, and you'll be able to get them afterwards. So I'm not going to read through this all with you, but just to let you know about what we do is, as I said, I work with two groups of people. The first group that I work with are software engineers and a software development team that is building this platform called Beacon. Beacon is a cloud-based emergency dispatch software designed to send the right responder to the right location at the right time. And we work with a wide group of different emergency response agencies that are using Beacon. And the second group of people that I work with are those program managers who are using Beacon to manage and coordinate their response teams. And three of them are with us today that we've already introduced. Dr. Marco Hingi from the Tanzania Rural Health Movement, Molly Klarman from Motomeds Haiti, and Katrina Ray here from Impact International. And as I mentioned, we've got about now programs in 20 to 25 countries actively using Beacon to alert, coordinate, and track their responders. And the types of programs that are using Beacon fall into about three categories. The first category is our traditional emergency services. So EMS, fire department, disaster, search and response teams. The second is what we call crisis or alternative response. And these are more vertical programs that are focused on one type of crisis or emergency. And this includes maternal child health, mental health emergencies, gender-based or domestic violence, substance use, opioid overdoses, and even we've got some groups using it for gang violence intervention here in the United States. And then the third category is what we call community care. And this is more observation, keeping an eye on things and lending assistance, but not critical necessarily, or at least when it starts, it's not critical. And that includes neighborhood watch or roadside assistance. And Impact International, who's on the call today, actually, we worked with them on a big program for COVID-19 resource delivery at the beginning of the pandemic. So you're probably wondering, how is it that we have all of these different organizations respond to very different emergencies and using the same platform? And the answer is because, as it turns out, emergency communications are not all that complicated. A lot of people oftentimes get a little daunted by the word emergency, and they're imagining chaos. And, you're watching the news this morning about Libya or Ukraine or what's been going on in Morocco, and you're seeing scenes of what looks like chaos or very unpredictable situations. The reality is that the communications needed to organize a proper emergency system, again, are pretty straightforward. And if you look at it, you can break it down into two legs. The first leg is how the public calls for help. And there are 100 ways that you can set this up. And many of you on this call right now may already have this set up. And it can happen via a crisis hotline, a phone number, a short code, a long code. There are people who use email intake forms. Many people around the world are using WhatsApp to report emergencies. And frankly, as things go and your system grows or your service grows, the technology used for the public to call for help can change. Much of the way that systems are set up to call for help are very dependent upon the local environment. What are the available technologies? What's in the budget? And what are the needs? We're not going to spend a lot of time today talking about call intake because there's so many different ways that it can be done. Our three guests will talk briefly about how they're managing call intake. But what we really want to focus on is the second half, right? If most organizations are able in one way or another to set up a way to call for help, a part that's often overlooked is what happens afterwards, or is what we call response dispatch. And that is to say, now that you know where the emergency is, now that you know where somebody needs help, how do you coordinate a proper response? How do you send the right responder to the right location at the right time? And this is what we focus on with our Beacon platform. And I'm going to give you now a quick demo of it. I'm going to switch screens here so you can see. And then we're going to talk with our guests about how they're actually doing it. And I just want to make sure if somebody can nod their head, you can see my screen here. Okay, great. So Beacon has two components to it. What you're looking at is the web application for dispatchers. Now imagine you're in a call center or an office, or frankly, at a kitchen table, and you've got your laptop or computer in front of you. And this is where you would be accepting calls or requests for emergency assistance from the community. And so the dispatcher, the operator, takes the call, they answer the request for assistance, and now they're looking at their resources. And as you can see here, we have customizable maps, which you can put whatever kind of map marker you need onto this map. So here we have a fire station. Oh, it's not. Let me go do that again here. So over here, we have a fire station. Here we have a hospital. Let's say that there's flooding going on here, and next to that flooding, there's an encampment. Everything that you put on this map is going to show up on the responder's mobile app as well. So you can see that there are active incidents going on too. Right here's a motorcycle collision, we could say. Over here is a woman who's in labor times 28 weeks with heavy bleeding. And then we can also put it safety alerts, right? Maybe you've responded to locations where in the past it was a little dangerous for responders, or you just needed to make notes. Then we're able to put those on the map as well. And if you think about what's going on in Morocco, earthquake happens, there's debris all over the place. Maybe you need to identify specific evacuation routes for ingress and egress. You can put those on our maps as well. On the left side is where all of your responders are. And if your responders have GPS enabled on their mobile apps, you can click on their icon and zoom and see their exact location. Now you can see that these responders are in different colors. Green means available. They're able to respond to an incident right now. And any other color means that they are currently assigned to an incident. There's something going on and they're already involved. In this panel right here, we have all of our active incidents. And we have three types of incidents that you would send your responders to. There's immediate, which means they need to go for help now. There's queued, which is get to it when you can. Maybe you don't have enough responders, or maybe it's just not that urgent. Or they're scheduled. So tomorrow, a checkup at 5 p.m. for a mental health follow-up, whatever it may be. And if you open up the card, you'll see all of the information, where the incident is, the type of incident, who's assigned to it, and what their current status is. If you need to send them a chat message or a call to them, you can click buttons and be in instant communication with them. Over here on the right side, you'll see is a bit of a feed. So if you have lots of responders responding over multiple incidents, then you can see the feed over here of what's happening most recently. There's also an entire suite of chat groups. So you can have private groups, you can have individual groups, you can have all hands groups. But really the heart of it is this panel right here, which is where you would create an incident. And so let's just say, for example, that we know the location of the incident, we've put it in the address bar, or if there isn't a physical address, you could come and type it in here directly. But let's say we've got an incident at that location, and we'll say it's a sick child who's been vomiting times 2 days, lethargic, and mother's worried. Let's say the mother called up and she gave her phone number, and you need to get an exact location from her. You can send a text message to her, and that text message, assuming she's using a smartphone, has a link that she can click. And when she clicks that link, it's going to give you her exact address. So if you're working in an area that doesn't have physical addresses, this helps you get exact GPS coordinates. But we're going to call this an emergency. And all these categories we have here, these are totally customizable, so you can make them say whatever you want. And we're going to call this obstetrics and child, well, we can call it vomit and diarrhea. So whatever you want to call the categories, you can do that custom. So we're going to call this an immediate incident, the dispatch type, and this is where Beacon, in our minds, is very unique. There are multiple ways that you can send out alerts. One example is you could broadcast it. So let's say you had a group of volunteers and you didn't know who was closest. You could essentially crowdsource the nearest responder by sending it out as a broadcast alert. And you could select certain tags so it would be sent to only particular responders in particular areas or with particular skills. But whatever it is, this is a way that you could send it out to a group of responders and find out who can get there quickest. The other way is the traditional way, which is, I know I want crisis team 4 to go, and they're the only ones who are going to hear about this. Then a third way that you can send out alerts is that you could do both. You could say, I'm going to send this ambulance or this vehicle, but the vehicle is an hour away. And so we're going to blast it out to a group of community responders who are nearby. They can get on scene quickly, stabilize the patient, assess the scene while the vehicle is en route. And that could save a lot of time and actually get care to the patient quicker than normal. So there are a lot of other features and functionality in Beacon, but I'm going to not get into them for the sake of time. But real quickly, just show you here how it actually works when you create an incident. So we've got the location, we've got the description, the class category type, and we're going to assign crisis team 4. So I would click create. And as soon as I do that, you're going to see over here, and you can hear it, that I've been assigned to an incident. And so now the mobile app, and just as a heads up, if you have responders that don't have internet or don't have smartphones, all of these messages you're about to see in the mobile app can also be sent via SMS. And that's actually how we started this whole system, was SMS only. So if you're in low bandwidth settings, or like I said, no internet or no smartphones, all of this can happen via SMS. But as you can see, the message comes in, and now Beacon walks the responders through the same repeated steps over and over again, which is, please let us know when you're en route. So they say they're en route, and you can see here, their status is going to change. They're now turning red. If you open it up, you'll see that they're en route. Over here, they're turned red, they're on their way. Over here, it gets updated as well. So everywhere the dispatcher is looking, they see what the current status of the responders are. The next is, let us know when you get on scene. So the responder, when they get on scene, they would say, I'm on scene. Or if they couldn't locate, they would say, I can't locate the patient. And you could set up a chat or push to talk communications between you and the dispatcher to get more information. I'll say I'm on scene. You can get turn-by-turn instructions through your mapping application as well. Now it wants to know, do I need additional resources? I can open up the sidebar and I can see all of the resources that are currently assigned to other incidents, and I can see who's available. And with the right permissions, I can also see where their location is. I'll skip that. It's okay. We've got this under control. We don't need more resources, but we are going to transport this child to a facility. So we would say confirm, and we're going to, we'll say UCSD pediatric ward. And we'll be there in 15 minutes, and we're taking one patient. And as soon as we do that, it would send a message to that hospital or that facility saying, here comes crisis team 4 with one patient. They'll be there in 15 minutes. Here's their phone number if you'd like to call them. Then we travel to the destination. When we get there, we would say, here we are, we're at the destination. We bring the patient in, hand it over to the doctor and nurses, give a turnover report, come back out to the vehicle. And when we're finished, we click complete. And now we have the option to either add generic notes, meaning no protected health information, no personally identifiable information, or we have also what we would call in the United States a HIPAA compliant case report, effectively an electronic health record. So I can go in there and I can fill out all the information, interventions, medications, if we were taking vital signs, whatever it may be, or if it's just notes about the condition of the patient and the interaction. You can add all of that there, and they are in protected, encrypted modules. So again, there are a lot of other features and functionality to Beacon. In fact, 80% of what you see in the web app can be done through the mobile app alone. We have a lot of grassroots groups that don't ever log into the web application. They do everything through the mobile application. But again, it's a very repetitive, cyclical process. Can you go? Are you on scene? Do you need additional resources? If you're transporting, let us know where you're taking them. Let us know when you get there, and let us know when you're finished. And that, in a nutshell, is how Beacon works. And that's how most dispatch platforms function, whether you're in a very high volume system or you're in a very low volume system. You've got to go through the same steps every time. And so now, to talk a little bit more about how Beacon is being used, we're going to get involved here with our guest. Let me, switch back here. And if you can just nod, let me know that you can see this again. We're good? Excellent, thank you. Okay, so you're probably wondering, how do we go about setting this up, right? Well, in order to figure out what's needed in your communication systems, we have a very simple assessment. And this is the assessment that we're going to go through with our guests here. But there are basically 6 questions that we ask. One is the scope. What types of emergencies, crises are happening? Are you dealing with all sorts of emergencies, whatever people call with, or are you dealing with specific, we'll call vertical aligned response systems? Then, how do people call for help? How do they access help? The third question, how are incoming calls triaged? So when they make that call for help or they send you that request for assistance, how do you decide what the priority is? How do you decide what resources are needed, if any at all? Then once you've made that triage decision about who's going to go, how do you actually manage the alerting and coordinating? And that's what we manage through Beacon. Then the big question is, when they get on scene, and this is where things differ, right? The logistics of sending responders to certain locations is very predictable, very repeatable. But what happens when they get on scene is entirely up to their training, the resources, and basically the program that you're running. So the 5th question is, what do they do when they get on scene? And then finally, how do you know when the final objective is met? We work with some groups, ambulance services, that will transport patients. We work with other groups that don't do any transport. They take care of everything on scene, and maybe they refer them to somebody else. But whatever the program is you're running, there's got to be a resolution. How do you know when the final objective is met? And so now I'm going to turn over to our guests, and we're going to go through these same assessment with them and let them talk about how they've used that to implement their program. And the first we're going to speak with is Dr. Marco Hingi, who's in Mwanza, Tanzania. And frankly, Dr. Hingi's program in Mwanza was one of the first we ever launched back in 2015. And as you can see here is a picture of the call center. And then on the right are the Boda motorcycle taxi drivers that they're using as responders. And Dr. Hingi, if you could come off of mute.
Yes, thank you very much, Jason. Dr. Marco Hingi from Tanzania's movement, and we are working to provide pre-hospital care services in Tanzania for the past 8 years. So what actually we are doing in our setting, just like a general information that we didn't have any pre-hospital care services. And that also accompanied with a lot of people who were dying before arrival to the hospital. So there's also a huge need to start the pre-hospital care services at risk to save the lives of people. So due to the development in our settings, we have a lot of road traffic accidents, despite still we have obstetric cases that they need emergency care. And in our setting, we have trained the first responders. Currently, we have 25 first responders who are responding, and most of the cases that we are responding are road traffic accidents. So the community over here, actually, we are trying to promote our toll-free numbers, which we have, and it's a free number. So people, they can call whenever they witness medical emergency, then we respond. But the response also goes to the beacon, which support us with our communication. As you know that we have 25 first responders on the streets, and we need to notify them what is happening and how they can go to respond at a shorter distance as possible. These ones, in terms of our dispatching system, actually for us, because of the existing environment and resources that we have, we're using SMS. So we have trained our first responders to respond in terms of responding to SMS, which is it's a coded SMS, so it's easier to respond and to ensure that all sequences on emergency care services have been achieved, from the receiving the call up to the delivering the patient to the hospital. And our first responders are trained on the basic first aid skills, and we equip them with equipment to support them with provision of healthcare services, emergency care, and they just do basic care. And also they support sometimes by using the vehicles from bystanders, or by using our ambulance, or by using their motorcycles, they can transport the patient to the hospital. And we are so keen on when we evaluate our program is on the number of the incidents that we have dispatched, and that correlate with the marketing strategy that we have done to the community, but also the response time. We try to maintain as short as possible. Our data shows that for now we respond within 7 minutes, and also the number of hospital transports that we have done. Yeah, so probably that is briefly about us and what we are doing in Mwanza. Back to you, Jason.
Thank you, Dr. Hingie. Appreciate it very much. And if I can just add a quick comment, Dr. Hingie started this program from scratch. He had a group of boda taxi drivers that he knew were already responding to emergencies, but they didn't really know what they were doing in that response. So he got them together and trained them in basic life support, equipped them with a way to alert them. And when they first started, they were doing a handful of incidents per month. And I think last month they did 75 road traffic injury responses along with some other medical calls. But as he mentioned, their average response time now is about 7 minutes, which is going to match the EMS response time of any high-income country that's running a formal EMS system. So it's really incredible work that Dr. Marco Hingie's been doing, and it's been such a pleasure to work alongside with him all these years. Thank you, Dr. Hingie. Next up is Molly Klarman, who is the program director for MotoMeds Haiti. And MotoMeds Haiti is a nighttime pediatric healthcare hotline and delivery system. And you can see here are their nurse dispatchers on the left, and then the local motorcycle taxi drivers that they're working with. And Molly's going to fill in more details on how this program works. But I'll just add one thing here. This program launched in 2019 and has gone through as many disruptions and troubles as you can imagine, from civil unrest to drought to hurricanes and even earthquakes. And they have never stopped delivering their services. So a real testament to Molly and her team. And please, Molly, go ahead and share with the group how your program works.
Thanks, Jason. It's nice to be here with you all today. I'm Molly. I'm a research coordinator at University of Florida, and part of that role is the director of MotiMeds Haiti. MotiMeds is currently housed at University of Florida, where we are evaluating the project through a series of research studies. So as Jason said, MotiMeds is a nighttime pediatric telemedicine service for kids that has been operating in Haiti since fall of 2019. And we started operating in Ghana in fall of 2022. The workflow for Ghana is different, so I'll just be talking about Haiti today. And so like a little brief background on what MotiMeds does and why. We target children with common childhood illnesses when the illnesses are still in the pre-emergent state. So MotiMeds does not take on emergencies, and when we do encounter an emergent patient, we refer them to the hospital. Our objective is to provide early treatment to prevent illnesses from transitioning into emergencies. So for example, dehydration from diarrhea or cholera can be effectively treated with oral rehydration solution, but when not treated early, a young child could become severely dehydrated within a matter of hours, and then they require hospitalization and intravenous fluids, and treatment becomes more expensive and complicated. So however, in Haiti and similar environments, once clinics have closed at 2 p.m. or maybe 4 p.m., there are no options for pre-emergency care. So families are forced to wait until the morning, risking illness progression. So MotiMeds exists to fill the gap in care when clinics are closed. That's our scope. We operate a call center that families can access between 6 p.m. and 5 a.m. in Gressier, Haiti, and we currently have 2 delivery zones. One is surrounding the call center in Gressier and another about 175 kilometers away in the city of Lacaille. Parents call into the call center when their child is sick. We have a traditional long code phone number with the telecommunications company Digicel that forwards to Twilio Flex. And the nurses and nurse practitioners answer the calls and ask the parent targeted questions about the child's symptoms and past medical history, and use clinical decision support tools that our team created to triage and assess each child. Triage classifications include mild, moderate, and severe. For mild and moderate cases, providers create a treatment plan for where to be treated. This is either the hospital referral or home treatment, and how to be treated. This could include medication delivery with a provider exam, in-person exam, or virtual anticipatory guidance alone. So if the child lives within a delivery zone, an incident will be created using Beacon at the call center. Our responders are trained MotiMeds delivery drivers. However, we also have on-call nurses who are staged in our remote delivery zone who will receive incident alerts as well. Each night, we have 2 drivers on call in each delivery zone, and then due to safety concerns, they respond together. We broadcast the alerts. However, we only broadcast them to the team members who are on call and expected to respond. So I think it's a little different use case of the broadcast feature. We have used both the mobile version and the SMS version of Beacon, and we kind of switch back and forth. Each method we found has its pluses and minuses. And unfortunately, connectivity in our project area is very unreliable. It's not great for telemedicine. When a driver receives an alert, they proceed to either the call center office or the home of the on-call nurse in the remote delivery zone. This will depend on the location of the patient, and this is all this information is included in the incident, so they know where to go. The drivers pick up a package of medications and fluids and proceed to the child's home. They navigate unpaved roads with no address system or streetlights. Once they arrive at the child's home, they'll hand off the package and play an instructional video or multiple videos on a tablet for the parent. This video should instruct the parent how to prepare and take the medications. And then if a nurse has accompanied the delivery, the nurse will perform a basic exam. And the exams are typically reserved for moderate cases that are more difficult to manage through virtual engagement alone. If a child is found to be experiencing an emergency while the team is at the child's home, we do offer transport via motorcycle to the hospital, but families rarely accept this option because of financial barriers once they arrive at the hospital. And then that's it. The responders or the delivery drivers will report that they are finished, and then they're ready for another delivery. And oftentimes they have another incident already waiting for them. We use the queue feature because most of our calls come in shortly after 6 p.m. when we open. And so Beacon is a great resource for the call center providers to manage and track the delivery drivers, which is essential as we start adding more and more delivery zones to our central call center. Some of the outcome metrics that we track are how many cases we process a night. So currently that's about 3 per night. That we also track patients' clinical status at 10 days, and about 95% report that they have improved or they are recovered. We collect qualitative feedback on the service. Almost 100% say they would use the service again. And then we track adherence to our clinical guidelines. Those results are too complicated to share right now. And then we track time to arrival at the household, and that is averaging about 86 minutes, which is under our target of 2 hours.
Fantastic. Thank you, Molly. And maybe you could just share a little bit about how you launched the program in the aftermath of the Lake Hai earthquake, because you mentioned you have 2 delivery zones.
Yes. So we had wanted to open a remote delivery zone for a while to test what we call like the hub and spoke model. So for cost savings, the idea was to have one call center that handles all the incoming calls. And because it's fairly costly to operate at night and have the providers work basically all night long. So we wanted to see if we could service that call center with multiple delivery zones. And after the earthquake in Haiti in August of 2021, we did a site visit in Okai, and they had lost a lot of their medical infrastructure. And we've also found that there's, I mean, I guess no other project in Haiti or many, I mean, I can't say anywhere, but that's doing pre-emergency care at night. So there was definitely a need for that in Okai. So it was a great opportunity. We partnered with Jason on that that expansion of the project. And we weren't sure if it would work because the call center providers who are receiving the calls from the remote delivery zone aren't familiar with the like neighborhoods in Lakai. And one of the ways that MotoMeds works is that the delivery drivers have like an expert knowledge of their surroundings. So they don't use an address system. They just know like the big church or the that school or, you know, that bridge. And so the providers in our call center are receiving this information, and but they don't personally recognize it. So because they don't know the church or the bridge or whatnot. So they just, you know, record it and then they relay that back to the delivery drivers, and somehow it works. They are able to identify where the houses are to do the deliveries, even, you know, through this kind of like relayed chain of these like makeshift addresses.
Excellent. So now you've got those 2 programs running in Gressier and in Lake Hai, and then also launched another one in Ghana, which is going on. So it's really awesome to see MotoMeds thriving and growing, and really awesome to be partnering with you. Definitely hope to continue the expansion. So thank you very much, Molly. Finally, we have Katrina Ray here from Impact International, who's going to share a little bit about Impact's work with the Belize National Fire Service. And Katrina, if you could go ahead and unmute.
Yes, thank you so much for having me this morning. I am happy to share where we currently are, where we've come as an organization with Impact, working with the Belize National Fire Service, and using Trek Medics. My name is Katrina Ryer. I have been in the 911 emergency service field for over 25 years, working in a very high volume call center here in Washington State. And when I was asked to come on board with this project, I was exceptionally excited to be a part of that. Part of the our scope as far as our work with the National Fire Service is to help build the capabilities of the fire service, working to build out an arm of their service that is an emergency call center staffed by dispatchers. And so one of the things that we had to identify originally is what type of fires and emergencies are happening in Belize, how are emergency services accessed, And prior to the implementation of the ECC, people were calling their local clinics, calling their local fire stations that may or may not have somebody there to answer the phones. If there were road traffic accidents or calls involving law enforcement where someone was injured, quite often the police agency, the police units that were sent out would load victims up into the back of their pickup trucks to take them to local hospitals or clinics for treatment. So with the onset of the ECC, we are developing a medical and fire dispatch. Our dispatch center is manned 24/7, 365 by a minimum of 2 dispatchers, usually 3, who are set up. One dispatcher is set up in a call answering position. One dispatcher is actually working a radio position, so that supports the entry of information into Beacon. And then the third dispatcher is the lead. And so they work together to make sure that information is input into the CAD system, into Beacon, and then followed up with radio communications to attend to responder and citizen safety. So one of the ways that citizens were contacting emergency services again was through the phone calls directly to the stations. There was an emergency number established, which is 990, which is for fire and medical emergencies. There is a 911 in Belize, but it's law enforcement only. There is one call center in Belize City. Throughout the rest of the country, those calls go again directly to the police stations. So when we look at how calls are handled, we recognize that information is coming into us through different means. It can be through the citizens, the community who are getting used to a new number of 990, calling our dispatchers who have received training in that call intake, how to recognize what type of fire or medical emergency is occurring through the use of scripted questioning. But also one of the most important things for them is to know where to send help. And that is where I feel like Beacon has an amazing capability with the ability to put a pin on a map. One of the most challenging things often for callers is they may not know their location. Even in our communities here in the United States, people struggle. And so the dispatchers have to be able to locate them. And so the features that Jason had previously referenced are exceptionally helpful in locating the citizens, knowing where to send help. And that's in addition to the questions that they have to ask in order to use the mapping. So when the dispatchers receive that call on the 990 number, our goal is for them to have a call ready to dispatch in a minute or less. And so that is generally initiated with 4 pieces of information: the location, the call type, the caller's name, and the phone number. They can assign and broadcast that call to responding units, tagging the specific responders. And then they can add additional information and be able to share that information with the responders as they are heading out to the scene. The responders are heading out in ambulances or medic units and engines, obviously, depending on whether it's fire, EMS, or the need for both. And so when the responders receive this information in Beacon, they put themselves en route, which then gives a timestamp and a location stamp and is able to document their status, maintain that communication, which previously was ineffective. There really was no effective means of sharing information between fire stations or between districts in Belize. So Beacon is allowing us to collect all of that data, maintain a status notification of our responders. We know where they are. If there is an issue, we can go out over the radio to check on their safety, check on their status. When they get on scene, most of the responders are EMR trained. There are a few EMTs that are on board the medic units. They will transport them to the local hospitals who are also on our system. And so that pre-arrival intervention is a big part of what they're doing. So prior to the implementation of Beacon in Belize, again, there really was no effective means of documenting all of this information. That's currently the data that we are gathering to be able to look at those average response times for the incidents that are dispatched, how long it takes them to get on scene and route arrival at the hospital on their transports. With that, we have already demonstrated that the system has worked beautifully through follow-up reports that the stations have requested from us. And right now we are currently in the Cayo district, so it's just one of 6 districts in Belize. With the expansion of the ECC, we will be looking at expanding that to the other 5 districts, obviously in a means that makes sense. And I think that's really all I have for now, unless somebody has a question, Jason.
Thank you, Katrina. I'm actually looking here. Somebody's asking, is Beacon available for island communities in Belize?
With the expansion, that the intent is that it will be available through all of Belize. And so working with the fire service on that expansion is a very carefully coordinated expansion, looking at the demographics for the different districts, how many fire stations, what is the access for them. There are a couple of different ways, from my perspective, of looking at expansion, whether you have one ECC that simply expands the jurisdiction and the response to the other districts, or whether the fire service makes a determination to have multiple ECCs throughout the country. But ultimately, all of Belize would be on this system through the expansion.
Definitely the goal. Absolutely. Yes. And off to a great start. Thank you very much, Katrina. It's really been fantastic seeing the work down there that you guys have all been doing in Belize. And just for the audience to get an idea, Trek Medics, we're primarily a technology provider. And so we are very much dependent on collaborations with organizations, and the 3 that have presented today, Tanzania Rural Health Movement, MotoMeds, and Impact. They play such pivotal roles because they're actually the ones doing the program implementation and the management of the day-to-day operations. And so as an organization ourselves, we are very much dependent and eager to partner with those groups that have a presence on the ground. And really, with Impact, it's been so awesome because of all the training that you've done, in addition to setting up the Emergency Communications Center. If the audience takes the time and goes and checks out Impact's Facebook or LinkedIn or social media, I mean, all of the different ropes rescue and search and rescue, training that you've been doing with the fire department has just been really cool to see. And we're so grateful for it because obviously it's a symbiotic relationship. If you have trained responders in vehicles, but they don't know when and where they're needed, the training in the vehicles don't make much of a difference. But if you've got a fantastic communication system, but your responders aren't trained and they aren't, equipped to do much, then it's half the job as well. So it's been a real pleasure working with you all, and thank you for joining. I'm going to turn it over to questions in just 1 second, but here's some more information to contact, just so you know. If you're interested in learning more about Beacon, you can go to our website and create your own account and get up and running on your own. And one story I like to share about this, just to give you an example of how this works, is last year, Hurricane Ian was heading towards southwestern Florida. And we put out some Facebook ads targeted at search and rescue teams firefighters, EMTs in Florida to say, look, if you want to use Beacon for any response operations, because oftentimes in the aftermath of a hurricane, the local 911 call center will be overwhelmed or out of operation. And we said, look, if you want to use Beacon for free, by all means, create an account. And that night we saw somebody in Central Florida had created an account on Beacon and were playing around with it. And then they stopped using it. And then the next day, Hurricane Ian hit. And then shortly after that, I went and looked again. And the group that had created their account on Beacon now had 25 responders. And they were sending them up and down the coast from Naples, which is almost the southwest corner of Florida, all the way to Tampa, which is kind of halfway up the western coast of Florida. And over the next 4 or 5 days, they did 200, 250 responses, and they never spoke to us. We sent them emails and text messages saying, hey, how can we help you? We'd like to learn more. And they never got back to us. Well, a year later, just this past week, another hurricane was headed towards Florida, Idalia. And lo and behold, we saw that they jumped up on Beacon and got it up and running again. And this time we were able to get in contact with them. And it turns out it was the state fire marshal's department. And they were sending search and rescue teams, but also mental wellness teams to go check on firefighters, EMTs, and other public safety responders who had been impacted by the hurricane, whether they had lost their home to flooding or to the heavy winds, or were just dealing with the stresses of responding during a terrible, terrible hurricane. And they said, you know, this has been the coolest software for us, that we got up and running on it without talking to anybody, and we're able to manage a lot of responders over a very big geographic area. So I love that story because it just shows what we've been able to build, and we've been able to build all of that thanks to these partners here. Cisco, New Relic, PagerDuty, and Twilio have been absolutely essential partners, providing us both with financial support, but also with technical know-how and expertise that has been truly essential in letting us accomplish all that we have. So if you'd like to play around with Beacon or create your own account, you can do that at trekmedics.org. But you also have here all of our contact information, and I'd encourage you to reach out to anybody if you'd like to learn more about their programs. And again, thank you so much to NetHope making this possible and really just giving us an opportunity to share with the larger community what we've been doing. If anyone has any questions, I'd be glad to answer them now. Or for any of our guests. Looking here in the chat, not sure if I see anything, so. If there are no questions, then we can give you 10 minutes back of your morning or afternoon, evening, wherever you may be.
Thank you, Jason. That was incredible. I'll look for any questions here. Looks like we're going to wind up ending up a little early today, which is great. These stories were fantastic. Thank you so much. Thank you, everyone, for showing up today. Thank you again to our speakers. Remember, everyone, this webinar series needs your voice. You can help us improve this vital resource for the NetHope community by filling out our satisfaction survey. Links are in the chat, and they will also be in our follow-up email and on the webinar landing page at nethope.org. There will be a follow-up email coming your way in the next day or two with links to the webinar recording, the slides, and other resources shared during today's presentation and discussion. And on behalf of our presenters and NetHope, we wish you a great rest of your day wherever you are in our wide world, and thank you.
Thank you very much. And just one last comment, well, two. John, yes, there is a SMS-only solution. Feel free to reach out to me, and I'd be happy to share that with you, more about that. But also, we will be at the NetHope Summit presenting more on the Belize program. But also, we have a booth there. So if you or any of your colleagues are going to be at the NetHope Summit in October, be sure to stop by and say hello.
Yes, we're very excited to see you in Munich this October, Jason.
Thank you very much.
All right, thanks. Take care. Bye-bye.
Bye-bye.